so much, Ontario Heroes, Praveen, Donna, and Patricia. Patricia, that was a good introduction. Thank you so much. But that makes me feel old. Being like 1994, I completed my dentistry, and here I am, 2021. That's a long time, 27 years. That makes me feel old. But I'm still.
You don't look old, please. No.
As you said, I'm very young at heart. I love what I do. I'm very passionate of anything I do. Yeah, thanks everybody who's joined in. I hope I will live up to the introduction that Patricia has given about me, and I will make it worth your while that you have taken off your time from valuable time from being with the family, enjoying outside. It's a beautiful day out here in Toronto. So you have taken time off from all that and sitting in front of the computer listening to me talk. Thank you so much for that, and I hope I'll make it worth your while. And let's start. A brief about me, as Patricia said, I am a practicing dentist here in Milton, Ontario. I do have 4 offices. I manage them, plus I do other stuffs too, which I will tell now. So a disclaimer, I very much thank Ontario Heroes for giving me this platform. And so Ontario Heroes doesn't pay me. And I am the owner of Sapphire Dental Centers. I'm an owner of Sapphire Health Construction too. I do a lot of construction work in dental offices. I renovate, I build dental offices. So I am owner of that. I'm a CEO of a dental club. I teach dentists, not international dentists, but I teach dentists from licensed dentists. I teach them orofacial pain and implants. And I'm also a foreign or overseas faculty at SRM Dental College, Madras, Chennai. So I'm a faculty there too, which I haven't written here. And just to as a disclaimer, I am not. Hello. As a disclaimer, I am not being paid for this talk, and none of my organization has sponsored anything. And I'm not being paid for any other organization that run coaching classes or other classes towards this. And I will not be sharing numbers or names of anybody who are doing that. I do know all of them. In fact, if not all, at least most of them. If you need any assistance, you can contact me later on. I can help you, guide you according to your location, but I will not be promoting anybody now or in future too. So what is the licensing path? So before I start, if you have any questions, I know a lot of you will have a lot of questions. If you have any questions, hang on to them. You can actually, if you want, you can type to Patricia. She will put it up. But what one of the coordinators of Ontario Heroes did is he collected questions from you guys and have given it to me, and I have chosen the questions from them, the important questions from them, and I have put it up here, and I will be answering them. Now, another disclaimer or revelation probably should be that I am no expert in this field. I do not run any coaching classes for international dentists. I'm no expert in this field. I'm not a lawyer. I'm a dentist who practices and who do construction work. But I am a dentist who's gone through the process. I do know how it was, how tough it was. I'm here to share my knowledge to you guys. I'm here to advise you how it was for me and what I went through, and to compile. A lot of people even now call me and ask me or text me through their acquaintances or common acquaintances, text me and ask me how to go about it and what are they. So I was thinking about this, and that's when Praveen approached me, and so I just wanted to do it, and that's why I'm here. Now, there are 2 types of graduates: accredited and non-accredited. Accredited are those people who have studied in the US or in the Canada, some universities of Australia, some universities of New Zealand, and some universities of Ireland. If candidates from here are all accredited, so they have to be CODA accredited or CDAC accredited. CODA is the US, CDAC is a Canadian, so they have to be accredited, and they come here and take the licensing exam, which is OSCE. They take it and become licensed dentists in whichever state they want to be. Non-accredited, everybody else is or are called as non-accredited dental students. Now, is it not possible to practice or license here for those people who are from abroad? No, it's possible. They have given a pathway, and the reason why they have the reason why they have done this is for people like us who want to work hard and who want to come to Canada and practice. They have opened it up for us here, and it's been there always. It's been there always. In those days, what my people who have gone above me, before me in those days, they said it was really tough in those days, and they had to do it in patience. But now they have made the process even easier. So as you listen to people, as you talk to people, they will say, "Oh, now it's made really tough. It's very tough to get through." It's not true. It's not true. It was really tough in those days, but now it's made even more easier. There's a process. There is organized. There are people who are assigned to it, and now it's streamlined and easier. But still, as any processes, there are problems, there are issues that you face, but the NDEB and the CDRAF, these people are all ready to look out and correct it as they go. Now, you can ask me, or rather, I had this question in those days. Why am I called non-accredited? Did I not study the same books? Did I not follow the same pattern as it is in the US and Canada? As you know, most of our dental books are written by authors here. Like one of my favorite authors, Tenkate, like oral histology. He was the dean of University of Toronto. So you can imagine how proud I was when I was walking the halls of University of Toronto. My favorite book, and we studied his book, Dr. Bosher, Complete Edge of Prosthodontics. The main chief editor was for a long time. He's a prosthodontist at the University of Toronto. He retired now. So we studied their books. Now, how can you call me non-accredited when I've studied all your books, I've followed the pattern, I've gone through exams, I've studied, worked hard to reach where I am, and now you're calling me non-accredited? The reason why they say this is everything in Canada and the US is equal. Equality is what they look for, and everything they want it to be equal. Now, why? They just don't want to expose themselves. The government doesn't want to expose themselves, or the dental association or the dental body doesn't want to expose itself to legal issues. So they want to make sure that everybody is treated equal, everybody has equal knowledge. Supposing any problem happens in future and somebody goes and gives a lawsuit, and one of the accused would be the dental licensing body, the Royal College. Now, then they can always say, we have done our due diligence, we have made the candidates go through an exam and made them on par, made them equal. We are sure that these people are equal, just like anybody from around here. They have been licensed, and we have put them through a process. We have checked them out, and now we can be sure that they are equal. And so they try to protect themselves. That's why it's not because we do not have the knowledge. It's not because we are not on par or anything like that. It's just that on legal standpoint, they just want to make sure that we do have the same knowledge and we are all on equal, and that's why they are conducting this exam. It is a exam, it's a rigorous exam, and needs a lot of hard work, needs a lot of persistence, and that only then you'll be able to succeed. Now, regarding the pathway there are 4 paths in this process. I will brief them. So it may not be easy to understand, but I will go slow, and I will be repeating some of them. And if you don't understand, you can definitely contact me later on, and I will try to help you out. So the 4 paths are equivalency process, advanced placement, or the DDS path. Then there is a clinical masters. Not many people do or follow this path. Then there is a specialist path. Specialist path, very restrictive and not very easy, and some of the specialty is not even accepted. Now, this is a brief. I will be putting up this slide later on, but this is a brief, an overall brief for you guys to know what exactly it is that we are facing, and what are these 4 paths: the equivalency process, the advanced placement, the clinical masters, and the specialist path. Equivalency process is where you take few exams, you challenge the exam, you challenge the licensing body, and you are taking few exams and proving that I am good enough. I don't have to go through a full-fledged program. I am good enough. Take me as I am. I'm ready. I'm coming for you. It's like our actor Rajinikanth, who goes out and he beats 100 people. Kind of, I kind of think that's how it is. So all those people who pass themselves must be the imaginary hero, our own Rajinikanth. So that's how it is. When I say that, I'm not only saying that as a little bit of humor, but also there's a lot of seriousness here. It's not easy, and I don't want to lighten that. It's not an easy exam. It's a tough exam. You're coming in and challenging the people here and saying that I'm good enough. Test me, and I'll show you how good I am. That's one path, and that's the equivalency process. Then comes the advanced placement. Advanced placement is now it's a DDS path. In those days, like way to 2006, I believe they started this, if I'm right, 2006, 2005, something around that time. And at that time, these people were called advanced or ITDs and international trained dentists. And the degree, they did not give a DDS. The only place that was giving DDS at that time was British Columbia, University of British Columbia. But most of the others were just giving an ITD certificate, making you equal to everybody else. And that's what it is. But now later on, by 2010-ish, they started giving DDS. The program certificate that you get is DDS, which is very useful, valuable, which is accepted in the US too. So you can, if you are going for residencies or if you want to pursue further higher education, you can apply in the US. You can even take a US license in the certain states or not certain states, in fact, all the states in the US, and you are good to practice in the US too. I do hold a practice license in the United States of Minnesota. It's an active license. I do hold it, but I have no time to go practice there. I'm busy here. Now, the next process is the clinical masters. Clinical masters program is just specialty, just like how we have in India and other places. Specialty, that's what it is. Now, in India, I know we write a test, we write an exam, and then try to get into a program. Here, it's not so. Here, it depends upon your GPAs, your DDS GPA, and then you have to apply. And there has to be some references from professors. Now, there has to be good references, not just like any reference. It has to be like somebody who's teaching at the university, somebody who's doing a lot of research. And now, these people who will not give you references just like that. They will give you references only if they know you. And for that, you have to have done some research with them, spend some time with them for them to know you, know how you are. And once they know you, they'll give a reference letter saying that I do know this person, he's good, and I say that he will be a good addition if you give him. So that's how it is. With that helps a lot, the references letter. And then they will take you in, they will interview you. So it's a very rigorous interview. And once you're accepted, then you have to study 3 years. Bank will help you for that 3-year program. Now, coming to the advanced placement, the previous one over here, the advanced placement program over here, or here, the bank will help you. I'll be talking about that later on. The bank will help you with that, the money. And then I want to say, coming back to our clinical masters, once you have finished the 3 years, you can take license and you become a specialty licensed.
Join by phone,
whoever it is, can you please mute your microphone, please? I believe it is disturbing everybody else. Or if the moderator can mute that person, please.
Yes, it's done. It's done.
Thank you very much. Thank you. Thank you. So now there is one thing that I have to tell you here, which is people can ask me, I am not a licensed general dentist. Can I come in from a foreign country, do my clinical masters and become a licensed specialist? Yes, in fact, you can. But in Canada, you are only allowed to do that specialty. So you're not allowed to do dental dentistry. You're not allowed to do anything else. But if you're an endodontist, you're allowed to do only endodontist. If you're a prosthodontist, you're allowed to do only prostho work. So that sort of thing. So that's what you're allowed to in Canada. Whereas in the US, it's different. If you go through a program, they will allow you to take a license as a general dentist and you can practice. It's a little bit different between US and Canada, but in Canada, this is how it is. It is, if you are doing a specialty program, you are a specialty, you are a specialist and you'll be allowed to practice that particular specialist. So please keep that in mind. Now, the next part is the DSCKE or a DSATP, which is the Dental Specialist Advanced Training Program pathway, where those who are specialists from overseas can apply for and equalize, try to equalize their specialty here in Canada. And once they feel that you're good enough, they will allow you to take the National Dental Specialty Exam, which is the NDSE, and then you become a licensed dentist here in Canada. So these are the 4 paths. It's a brief outline. Now let's dive in and see a little bit in detail. Now, what is the equivalency process? It was introduced in 2011 and was revised this year. And when I say revised, they have come up with more. Like I believe you're not allowed any pass mark. Any fail. Previously there were some fail. Now you have to pass everything. So those were the revisions. This scope of this lecture doesn't allow me to do that. You can go read it in the NDEP website. Everything is clearly given there. So just like advanced placement, equivalency process also has to have a profile and paperwork. I believe most of you would have done that. You have to apply for that, and they will do a background check. They will check your education, and then they'll get back to you and say, yes, you can now go ahead and take the exam, which is the 3 exams. The first one is the AFK, Assessment of Fundamental Knowledge. It's a tough exam, 200 MCQs. And you have 3 attempts for that. Now, regarding the exam, I just wanted you to share, I just wanted you to remember, or I wanted to share something that I've learned, something that I've observed about this exam. This exam, unlike the National Dental Board exam, is a bit different. Because, say, in a nutshell, to make it more clear to you, National Dental Board the US National Dental Board exams are black or white. It's either black or it's white. That's how it is. That's how they are supposed to ask the question, and that's how it's defined. It's either black or it's white. Now, in the Canadian system, it will be in the gray area. Say, like they will ask you questions like through the greater palatal foramen. You can give, the question will be, through the greater palatal foramen, the needle was injected to 14 millimeters, and what is the effective nerve that was anesthetized. Now, when you see that's a process, that's one of the technique to give an anesthesia for a maxillary nerve, but you have to inject it, or you have to insert the needle to the hilt to 27 millimeters to get that maxillary nerve anesthesia. Now, you have to read it's only 14. You may miss it. And then by mistakenly, you'll go and click maxillary nerve. You're gone. You're done. You will lose your mark there. So it's gray, very gray. So you have to be careful. You have to read well. You have to join up with other team members and with other people and join together, read carefully, attend some courses if you can, and then you can do it. Now, you can ask me my experience. How did you do it? When I took the exam, I was in Kuwait. I was working in Kuwait. Now, there was a friend of mine, a lady, she was in New York, and we both together studied, discussed questions. We both studied together over the Zoom. Like in those days, it was, what was it, Messenger or something like that. We both will come online after my this thing, and she would come sometime in the morning, and then we both will study together, and that's how I did. I didn't go to any coaching classes. So I'm not boasting, but I'm trying to tell you it's not necessary. You can do it, but there are ways to do it. But the best way is to join together, discuss and do it. Just remember, the Canadian dental exam is very gray. You have to be on top of it. You have to have a lot of knowledge. You have to cover up all the areas where you are not comfortable with, and then take this exam. So remember, there are only 3 attempts. If not, then you have to go back to that and become a regular student and come up from there. Now, the next exam here is a clinical judgment assessment. So this assesses your judging skills of the clinical scenarios and radiographs. I believe most of us will do well. Do we need any coaching? If you feel that you need it, you can take it. There are coaching centers for that. It all depends on how you feel and what you are, and then you can make a decision accordingly. Again, there are only 3 attempts. The next is the toughest of these 3, clinical dental skills. In the clinical dental skills, it's an unlimited number. Now, what is limiting here is the money. Like it's very expensive. Not just like 1,000, 2,000. It's around $9,000. It's very expensive, so you can't take it unlimited number of times. People usually do pass it.
ACS 5 വർഷത്തേക്ക് unlimited ആയിട്ട് ചെയ്യാം. ബാക്കി എല്ലാം 3 ട്രയലേ ഉള്ളൂ.
I'm sorry. Yeah. So clinical dental skills, you can take it unlimited number of times in a 5-year period. Now, what makes you eligible for that? The first exam, the AFK. People take the AFK and you have to pass. It's around 75. I think it's 75%. You have to get 75 marks to pass. Once you pass that, you can take whether you take the clinical judgment or clinical dental skills. Like you can interchange. You can take the dental skills first and then take the judgment, or you can take the judgment and then take the dental skills. But that doesn't matter. But the first exam should be AFK. You have to pass it to go for the other 2. It's not valid in the US. You are given a license to practice in Canada. It's not licensed in the US. So the overall cost is around 35. That's what the cost involved is the fees for the exam, all 3 exams, plus suppose if you're going to study in some coaching centers. There are a lot of coaching centers. If you're going to study in the coaching centers, that fee is also included. Now, in those days, when I started off, they were not paying any money for this. Nowadays, they have recognized that there are people doing it, and there are some organized processes to these. The banks are starting to give, I believe it's around 35,000. The banks are starting to give that loan to them. So there is a loan available. You have to qualify, of course. You have to show your credit history. You have to have good credit history. People do pass. Though I told you it's not a very easy exam to pass. People do pass. Around 300 people do pass. Do I know anybody who have not completed it? Yes, I do know a lot of them who have not got through the 3 attempts in the first 2 exams, and so I do know a lot of them. So it's not that, as I said, it's not very easy exam. You have to be on top of your game, but it's not impossible. You can definitely do it. Advanced placement. This is I told you, you go through 2 years of school. and then you will end up getting a DDS certificate. What they are doing here is you take an exam, you take the AFK again. Here again, you have to take the first exam, AFK. You have to get high marks. Say I'm talking about anywhere above 85 plus. People are now consistently doing 90 plus, 95, 99. In fact, a person from Kerala got 100 percentile, that's been happening for the past 2-3 years. So the competition is pretty high. So you have to get good marks in the AFK, and then you start applying to the school. Now, University of Toronto does not have a bench exam where you don't need to sit down and write an exam or do a practical some practical processes or practical crown preparations and other assignments, and you don't have to do that. Whereas the University of Toronto will select you from your GPA back home and from your AFK mark, and then they will call you for an interview. You have to pass. Like the number of candidates that they're called for interview, I believe is 3 times more. So you have to beat 2 other person to be part of the dental school. They take 30 candidates every year. So if anybody needs any help, if you have passed the AFK and if you've been invited, please do call me. I can help you with that. I've cracked that interview. There are certain ways. They just want to know if you are teachable. That's all they want to know. So what they want to know is, please remember this. Then I was told this by a friend who had been here before me. They want you as a third year student. They do not want you as a specialist. They do not want you as an oral pathologist, oral medicine. They don't want you coming here and telling them, oh, I'm so and so, so you have to take me. They don't care. They don't want you. If you come and show them, or if you boast them, or if you tell them that I am so and so back home, so you have to give me the seat, they will say, door is out there, just walk out. They want you as a humble third year student, and you come here, and please do not be offended by what I'm saying. This is what it is. You have to be open to be taught. You have to be open to receive what is being taught here. They want you as a third year student, a humble third year student, not as somebody who's been in practice for 25 years, and they don't want you in here. No, ma'am, or no, sirs. So just be humble. Come here with that mind frame as I am a third year student. I'm ready to learn, and you just teach me. Please take me in and teach me. It is the course is around 3 years in University of British Columbia, but they stopped that program. They don't take any more. Here, other places, it's around 2.5 years. So half year, like the 6 months, you are taken through a bridging program and then later on, you are aligned into the third year, final year of the DDS program. So that's how they do it. And when you pass out, you are passing out as a full DDS candidate. And now this certificate is quite valid. You can use it in some parts of UK, New Zealand. Then you can use it in some parts of Australia, US, of course, US and Canada. You can use it. Very narrow opportunity. Very only 80 people are taken. The money, the cost. The minute you have that acceptance certificate from the dental school, you just go produce it in the bank. They will give you money. Now you have become a bankable candidate. Now they are ready to offer you money because now they know that you will do well no matter what as a dentist. Just to enumerate the number of seats that are available in the various universities. University of Toronto has 30 seats. London, Western Ontario has 20 seats. The rest all has 8 seats. University of British Columbia used to do more, like around 20, but they've stopped that program. They're not taking any more. So McGill, Manitoba, Saskatchewan, and Dalhousie, they're all taking, they're limited, less number of seats. All of them beautiful universities, beautiful places. And by the way, if I did not say it, Canada is a beautiful country. People are good. I love it. And it's a beautiful place to live. And all these places, they're so welcoming, they're nice, and it's a beautiful country. So if you have made the choice to move here, you made a right choice. It's a beautiful place to live. Now, don't hold me to this. It's by the side organization. they have given certain numbers, like this is for your references. So now to enumerate, it's better if you look at it as a tabular column. The first one is for the equivalency process. You have to pay that for the profile. You have to pay $1,000 for both advanced placement and the equivalency. You have to pay. That's where they start your profile and profile paperwork. And then you have to pay an exam fee of 1,000K. And now if you need to go for any classes, you don't need to. If you need to go for any classes, you have to pay I believe it's $5,000 in some places, but we're just telling you that this is how much it is. But different people charge different. So it's for the AFK up till here, it's the same for both. Now comes the ACJ, but the clinical exam. So for the clinical exam, the NDB fee is 5K. And then if you want to go for courses, you can pay somebody and then you can study. For the NDB, University of Toronto, this 5K is not there, $5,000. You don't have to pay for University of Toronto because there's no bench test. But Western Ontario, Manitoba, Saskatchewan, Dalhousie, and McGill. I do not know about McGill. I'm it's Montreal. I do not know. I'm sorry about that. But other places, I do know there is a bench test. I do know McGill has an interview too. Like it's a more organized and more tougher interview in McGill that I've heard. So about the clinical judgment, you see here $9,000, and that's the exam. You can take unlimited within a period of 5 years, but that's a lot of money. $9,000. Sorry, $9,000, $9,000. It's a lot of money. So if you want to take that, you can take it. But it's a lot of money. And there are coaching classes. You can take it, there are people. People do teach well. People teach well. Now, regarding the advanced placement, how much it is? It's anywhere from 150 to 250. $250,000 was for British Columbia, but other places, I believe it's around 160-ish, somewhere around that. You pay the first half a year fee, the bridging program fee, and then you pay the rest of it 1 year fee. That's around 90 or 100 grand per year, or 90 grand or somewhere around that. So overall, by the end of it, you're going to pay to the school around a little less than 200,000 plus the living expenses what they are giving you. So it's a lot of money. Now somebody had asked me the question, can I repay it? Yes, there are ways to repay it. You can pay it back fast if you're alone, if you're single, family is back home. You can go to the northern area, you can spend less money and just think of paying it back. There are people who like to pay it back. There are people who don't like to spend off that money and keep it there. Like it is spread over a period of 10 years. You can pay it back in a period of 10 years, little by little. That's also there. Then the last exam is the OSCE, which is the same for both the stream. You can take this exam and then get to be licensed. So the equivalency is an easier process, time-wise and money-wise, whereas the advanced placement is a longer program, time-wise and money-wise. It's more, but the toughness, the hard work that you require is a lot more in the equivalency than in the advanced placement. Clinical masters, I gave you a brief of how it is done. You can apply, you can find out what you want to do. You can apply to the universities. You need, again, I told you, you need that, that reference letters, otherwise they are not going to take you. There are people who come here from Saudi, from Kuwait. They are sponsored by their government. Maybe they have some agreement between them. A lot of Saudi candidates are here, but the international dentist fee is pretty high. If you're going for looking, or if you're going to look, or if you're planning to do clinical masters, I would advise you to first take the PR card here, PR status here, and then you look for it. At that time, you'll be a local candidate rather than an international candidate. Otherwise, it's going to be pretty expensive. You're going to pay 3 times what the others pay. Not a feasible option if you're coming from international, unless you are pretty comfortable financially from back home. So that's something that you can look towards. You need that reference letters from the professors to be accepted, and they will do an interview, and then they will take you in. The DSA TP, it's a tough exam. I've taken it, but unfortunately, and I wanted to share this, unfortunately at that time when I took it, they were not taking Prosto. Even now, I don't think they're taking Prosto. The reason the professor gave me was they won't pass you in the board exam. And also we don't have place to have you here. That's the reason he gave me. He didn't take me, even though he passed the exam. But ortho, I do know a lot of international Indian dentists who have become an orthodontist here. Ortho, endodontist, oral medicine, I believe they're taking. I know one pedo candidate that was taken like 7, 8 years, 10 years back. That's all I know about pedo. But I do know ortho and endo, they do take. Oral medicine, they have a program, but I haven't seen anybody. Probably now after I left the school, they might have taken, but that's what it is. Again, I just wanted to bring it up again after I've explained all these processes to you. Again, the tabular column, the different steps, just to remind you that both equivalency and advanced placement are equal till the AFK. After that, in the equivalency, there are 2 more exams. In the advanced placement, University of Toronto doesn't have a bench test, it's interview, but other universities, there is a bench test, and then you're going to be a regular dental student. Now, people who've been out of dental school for 10 years, 20 years, I was out of it, for nearly 15 years, and it was difficult for me to get adjusted to the student life. But keep your eyes and ears open. You will learn a lot of things that you do not know, or you thought you knew, but you learn a lot of things. So good learning experience. Have a positive attitude, and you will do well. Clinical masters, again, it's depends on what you want to do, and if you have the time, if you have the money to spare to take you through the 3-year processes, then why not? As a specialist, life is good here in Canada. You get a lot of work. Now, that's a brief about the dental processes. Now comes, how do I plan my trip? How do I do it? How do I achieve it? It has to be meticulously planned. Now, if you are alone, if you're single, you don't have children, or if you're single, you're married, it's easier. And you can plan it out, but you have to plan for how are you going to eat? How are you going to support yourself? Where are you going to stay? You need food, you need shelter, and you need clothes. So make sure that you have a plan for that. What did I do? I did some other courses like small businesses courses, and then I got accepted as a dental office manager, and that's how I survived. And then I used that money to support myself and my family. Now I had 2 children too, so I had to support myself, wife, and 2 children. My wife chipped in; she started working too. So it's a continuous, it's a group effort for you to make it into Canada and do well. Now, some people also think of doing dental assisting and dental hygiene or office management. Now, office management and healthcare management, a little tough to get into workforce, a little tough. Whereas dental assisting, it's crazy. There's a lot of demand for dental assisting now. We are not finding enough staffs. Dental hygiene, again, it's better than assisting. We are not finding dental hygiene. You get paid. Dental assisting, your pay probably will be starting somewhere around 18 plus and going up to 26, 27 for an experienced candidate. Dental hygiene, right now it's starting at around 38-ish and going up to 50 per hour I'm talking about. So dental hygiene is top recommended. It takes around 2 years to complete it in a private college. In George Brown Community College, it takes around 3 years. Dentist is also an option. You can challenge the exam, or you can go to George Brown and take the course and become a dentist. In dental hygiene and dentist, you're a licensed provider. You'll be seeing patients. Dental assisting, you're not licensed, but people would like you to take a dental assisting board exam. If not, even if you know it, it's fine. There are, you can ask, can I work as a dental assisting without going through a school? Yes, you can. If a dentist is willing to take you in and train you, I have 3 dental dentists working for me. These people are all are all trained by me. I train them how to do the sterilization. I train them how to assess me. Now there is a problem here. Two problems. One is you do not know the local sterilizing procedures. If somebody is going to train you, yes, good. That's the first problem. So you have to be trained in the materials assisting. You can take the material. If you know all these materials, you're a trained dentist, you know what is what, and that's easy to learn. But the sterilization is a very important, and stripping the dental rooms after operatories, after the process is done, you have to strip it, wipe. After every patient, we strip and clean and wipe, and everything is cleaned well, taken out. There's a process that we follow. I've seen not many people from overseas do know this. You have to be trained in this. If you are aware of all this, then you're good. The second problem is we're dentists. We like to see what's going on there, because that's what you are. Once you're a dentist, you're always a dentist. You like to see what the doctor is doing. Now you forget your assisting, and then you look at what the doctor is doing, because that's more interest for you. Now what happens is the assisting takes a backbench, and you're not a good assistant. So just be aware of that. Let the dentist do his work. Let the dentistry be apart. You just do assisting. Learn how to assist. Do your assisting. That's a major problem. And another problem is some of us have that attitude or have that thing in our mind that I am a dentist. People respected me back home, but now I am a part of the workforce. Unfortunately, you have taken the step to come in here, and you are not a dentist. You are a dental assistant. You are office staff, and you have to keep that crown down and behave and humble yourself and behave as part of a team. It's a team effort. We are all one team in that. It's a team effort. Only if you do have that team effort in your mind, that team mentality, you will be able to succeed. I do know a lot of them who are doing really well. I employ 3 of them, and I personally tell these people to take the exam, come out of it and study, and that becomes being in the dental field is a good way to do it. That keeps you motivated, that keeps you happy that you are in the dental field. But what I see being an employer also, I've seen this problem with some of the people. They come with that attitude that I'm well settled back home. Why am I doing this here? That's something that you have to take it out of your mind. The questions I got is, so these are few of the questions that I've selected. Others were all repetitive, so that's why I've selected what is there. If I clear the US Dental Board, is it possible to get a seat for DDS in Canadian University? No. It's in the Canadian University, you have to write the Canadian way, and only then you will be eligible for the seats here. Is coaching required for the practical exam? Depends on your ability. I've seen people without coaching come and pass. I have seen people with coaching not pass too. So it all depends on you. It's the mind frame. It's a mind frame. Basically, it's a mind frame. Tell yourself you're good enough. You learned well. Go to a coaching class just to put you there in the loop, and then probably it'll be easy for you. So, but others, it's not possible. They have to. They have family. They have dental offices back there, and it's difficult for them. They can phantom head and a motor, and then do it. Sorry. Yeah. What are the career opportunities for an international dentist and other alternative career opportunities? As a licensed dentist, it's really good. For an international dentist, otherwise, dental assisting, dental hygiene, denturist is a good one. If you can get, if you're smart, if you're people friendly, then you can get as a front office staff. That's also a good alternative. Well, I'm in construction. That's a beautiful opportunity there too. A lot of work there in construction. Whether equivalency can be initiated, completed from any foreign countries prior to come, you can definitely do your paperwork and your profile and other things from wherever you are. I do know some coaching classes are being conducted in Dubai. I do not know anything about it in India. I don't think anybody is doing it in India, but maybe if you ask around, you may find somebody doing it. I'm not sure. Sorry about that. Kindly mention about the study material. So, and solve questions, very important questions. The ndeb.ca site has released questions. It's around 200 pages. Please do not take the exam without going through every questions. Form a team, join like as a Zoom. Now we have Zoom, like 10, 15 of you can form a team and try to solve those papers. That itself is an easy way to study for the exam. The other exam that you should all buy is the solved ASTA question papers. There is around A to Z or A to M or something like that. ASTA release question papers. They're really good. So at least that will take you to 60 to 65% of the mark, because I do see a lot of ASTA questions coming in. So buy the ASTA, American Student Dental Association questions, release questions. Please take it. It's a good thing. I had it. Dental Dex and ASTA is something that you should always have. Study that, and that's good for you. ASTA, Dental Dex, and then do the NDEB release questions. Form a team, and then you'll be able to do it well. So you motivate each other, and very important. Form a team, and you can do it remotely through Zoom or through Log Me In. What is financial support? I mentioned that the bank will provide you around 35,000 for the equivalency process. And if you are accepted in the university, you don't have to worry. You have a certificate from the university. It's because it's a guaranteed thing that you're going to become a dentist, whatsoever. The university, my friend used to humor. He would say, they don't want you, because I was also scared. Will I finish my course after spending so much? He said, they want your money. They don't want you. They don't want to keep you. They don't want the seat being held by somebody else, because they can see that they can make the money somewhere else. Now, it's a joke. This is not true. But what I'm saying is the universities teach you well, and they will make sure that you are really good at what you do before they pass you. So you will definitely pass. If you are, you have to do something really stupid for you not to pass. After DDS, is it compulsory that we must work in a particular stream? Is it worth completing DDS? Absolutely. You don't have to. You're not like as a dentist. You're licensed to kill. Again, it's a joke. You're licensed to do everything. There's nothing to refrain you, but you have to follow the quality of standards in every work. You have to follow that quality. It's not necessary that you have to work in a outfield setup and before you come here. No, you can work anywhere. You can even open your own clinic. You can do that. If there are any community hospitals available, you can work there. I do know a lot of people who have done that. And what is a very common stream people take is they go north, or they go to the remote places where money is good because of the insurance, and they make that money after 1 or 2 years. After they have paid off their loans, they come back to Toronto, where a lot of people are there, or they come back to London, Ontario, anywhere in Ontario, they come back and they settle down here. So that's the normal process that people take. I believe that brings me to the end of this course, this lecture. I'm sorry if I've taken more time. Good. So it's good that I finished on time, 1 hour. So Ontario Heroes, I thank you for your platform that you have given me, and I hope everybody here has benefited from it. I see there are 77 of you here. Thank you so much for being here. Thanks for listening to me patiently. Thanks for having me once again, Ontario Heroes. And that's my information. If you need any information, please do contact me. I am a busy person. I'm not boasting when I say that. I'm a very busy person. I have multiple construction projects going on. Plus, once I'm in the clinic, I am a dentist. I treat patients. So don't expect me to answer your calls. Message, WhatsApp. I will get back to you if that's the case. Maybe not immediately, but I'll definitely get back to you. Thank you so much, Patricia. I will hand it over to you now.
Thank you so much, sir. It was, in fact, I don't know what to say. I'm like totally speechless because when we search about this equivalency process, in Google, it's all vague and like different people give different opinions. But this is like in a nutshell, like you have the entire navigation and everything. In fact, I really want your presentation. I don't know how to say that. Yeah. And so I do have some questions here. So the first question that I have here is, I think we already discussed about it, the books that is required for AFK.
Yeah, so when you ask the books, it's all books that you studied for your dentistry. But what I did is I took the dental decks and I took the ASTA. So what I did is I took one ASTA question paper and I solved it. Then I knew where I have to focus more. Now I found that oral pathology, that's a subject that we learn in the third year. So oral pathology is a subject that I need to learn. So I went back, I just skipped through the pages fast, and then I did the dental test, I did the ASTA, and then I took the NDEB release question papers and I started solving it. As I solve, take each question, and that's why I told you to form a team. Take each question as a book. You have to solve every, so there's a multiple choice, one question, there are 4 choices. Take and give weightage to each choice that you have. Each of them is put there for a reason. Try to say, why is it that I don't accept that? Why can't I say that is the right answer? Oh, I will share the screen share. Sorry. Did I switch it off?
Yeah, okay. Yeah, it's good now.
Sorry about that, Praveen. Yeah. All right. So now make sure you do the release question paper. Make sure you study the dental decks. Then that's the best advice I can give. And you have to read all the books. As I said, Dentcate was my favorite book. Oral histology, my favorite book. I love it. So, go ahead, please. Next question.
Okay. Yes, sir. So the next question is how to get into dental hygienist programs and dental assisting programs.
Dental assisting program, not tough. There are a lot of colleges, Medics colleges there, Georgian colleges there, George Brown colleges there. So you just apply. And if you show that you have an equivalent of a secondary school education, they'll take you in. It's not tough, not expensive either, like 15,000 or something like that. Dental hygiene is around 30 grand now, 30,000 now. There you have to probably take a small exam, and there are a lot of private. So it's Dr. Abbas. It's not a good temporary measure. So there is Dr. Abbas who said that it's not a good temporary measure. There are a lot of people have taken it. My wife took the dental hygiene program, and she's a dentist now. It all depends on who it is and what it is that you're looking for and the time frame. You can take whichever it is, but again, as Dr. Abbas said, it is better that you keep your focus. If you start earning money as a dental hygienist, you'll start earning money, and once your focus is gone, you are going to go in that direction, and then you lose focus. So make sure you do not lose focus. Always make sure you're focused on one path.
All right, sir. So our next question is, so what is the scope of dental hygienist? Like, what are how different is from dentist and being a dental hygienist?
So dentist, you do everything. You can do anything and everything as long as you do a standard of care. Dental hygienist, you are only doing the health of the patient. You're only doing the scaling, the cleaning of the patient, and of course the oral hygiene instructions. That's all you're doing as a dental hygienist.
Okay. So, and then we have another question. Does a maxillofacial surgeon can practice over Canada without a dual degree?
Can you come again? Does a maxillofacial surgeon?
Maxillofacial surgeon can practice in Canada without a dual degree.
Of course, yeah. So it's a good question, in fact. If you have a maxillofacial specialty, or if you have a maxillofacial specialty from Ontario, you can definitely practice your specialty. Definitely, you don't need a dual degree. Now, London, Ontario gives you an MD. I do not know about University of Toronto, but London, Ontario gives you an MD degree once you do the maxillofacial specialty there. Now, Ontario is different. Ontario doesn't allow you to do cancer surgeries. Ontario, meaning in the head and neck region. For that, you would need a dual degree. But whereas Montreal allows you to do. But in Ontario, if there is a neck cancer, head and neck cancer that is come up, then you are supposed to go to an ENT surgeon for that. But in Ontario, yes, there is restriction. That's a good question. There is restriction in Ontario, but you can definitely practice as a specialist here.
Okay. So speaking of the specialist pathway, so I believe that University of British Columbia is offering courses like oral medicine and oral pathology. So how was our practice going to be restricted? I mean, like, is there like any kind of limitation that we have to work in this particular hospital, or can we work in like whole of Canada?
You can work whole of Canada, no problem. Oral pathology, oral medicine, again, just like all specialists, these people are very difficult to come by. There's a lot of practice potential. Usually they associate themselves with the oral surgery clinic, and that's where they practice. But I do know oral pathologists who have their own specialty practice too. One more question I saw came up was, is the dental assisting limited to ladies? Is it a female oriented? Not exactly. I have a male assistant. I have no problems, and my patients also have no problem with that.
Okay. So I have a question here. So we have to join a dental degree in India, and then we are third year, and we have to apply to Canada or US. I'm not sure about this question.
Probably what they're asking is, can I come in after, without completing? I feel no, because as I said, the first step is the profile, the profile that you have to do. They are going to assess you if you have completed. Only then you are taken as a non-accredited. That's why I told you about accredited and non-accredited. You are non-accredited only if you complete, not if you don't. If you did not complete your degree, then you are non-accredited. You're not non-accredited. Sorry, you have to complete it. You cannot do third year and then come and continue your studies. No, you cannot.
Okay. So I have another question here. What are the universities that provide dental hygienist course, and what are the total expenses, and what's the duration of the course?
So George Brown, I know George Brown gives. That's a university. That's a community college. That's a government university. Very good course. It takes 3 years. But dental hygiene, otherwise, is there are a lot of dental hygiene private schools, private colleges. I do know British Columbia also gives a dental hygiene. University of Toronto, I don't think, instead of University of Toronto, it's George Brown that's giving the dental hygiene program. I do not think there is one in Western Ontario. I may be wrong. Please don't hold me to it. But I do know George Brown, British Columbia, and a lot of private colleges do offer the university program. The dental hygiene program. And again, dental assisting too. There's a lot of private colleges doing it.
So another question that I have is, so do we need experience as an Indian BDS graduate for applying for the DDS program or the equivalency?
They don't care. They don't care. Now, as you mentioned, I finished 94. It was difficult for me to sit down and read the books after so many years of clinical experience. And also as an experienced dentist who's worked on dental. Now the teeth and the typhodone don't behave the same. Typho is easier to cut. So you have to unlearn a lot of things. I feel, and the experienced candidates don't take it as a negative thing, but I feel new candidates take a better, like a recent graduates take a better to the process than an older generation dentist. Well, I am an older generation dentist, so I am proof of it. I've gone through that. So it's not an impossibility. Anybody can do it if you put your heart to it.
So the next question here is dental specialty a better option than DDS?
Dental specialists do make a lot of money, and there is a lot of opportunities there. Yes, it is a good opportunity. It all depends on what you want. I'm a dental specialist in India. I could have stuck myself to prosthodontist, but I do enjoy what I do. I do ortho. I do a lot of implant surgeries. I do a lot of perio surgeries. So my skills are varied. I'm a general dentist, but I do everything that I do to a standard of care. So it all depends on what you want. You want to be close to your patients, or you just want to be, you don't like it. You just want to treat and tell them, go back to your dentist for somebody else to do their regular care. What is it that you want? That's how you have to select whether you want to be a specialist or not.
So we have another question. Does implants come under the scope of practice for a periodontist?
Yes, of course. And also some endodontists do it. Some prosthodontists do it. Single tooth implants, endodontists are taught at University of Toronto to do single tooth implants. Prosthodontists, of course, do it. Periodontist, oral surgeon. Of course.
So another question here is after getting PR, how much will be the tuition fee for the university per year?
I told you it's only 1/3. It's 1/3 the normal.
Yeah, because it's mentioned as 90,000 to 100,000. I think in your presentation. So was that fee for the international students or for the PR?
Oh, for the PR. That's for the PR. That's how much the regular students pay here.
Okay.
Yeah.
Okay. So is it good idea to take NDAEB first, get exposure to the dental field, and then take NDEB?
So I told you that it's not a necessity that you have to take the assisting board. If you can take if you're going to take the school for the dental assisting, then it's good to take the NDAEB. If not, it all depends. It's a personal thing. But is it a must? No. Is it going to help you? Depends. Very subjective question.
Yes. So after grade 12 in India, what is the process of applying for dental degree in Canada?
Tough question for me because I didn't go through that process. I do know that you have to write a DAT exam and then apply. Dentistry, as you know, is equally tough to get in, just like as medicine in Canada. It's a very tough program to get into. Not easy. So you have to first of all qualify that you are equal to the Canadian secondary school education, and then after you prove that, then you have to take the DAT exam, and then you can apply. So DAT exam is not an easy exam.
And I think we covered this question. After getting PR, what will be the expense for the dental hygiene course and the duration of the course?
You're a local student then, and it's 1/3 the international cost.
And I believe that it should be around 2 years. That the course should be 2 years, right? The duration
depends on the school that you're going. If it is the university George Brown University, then it's 3 years. If it is others, I believe it's a little more than 2 years.
And we have one more question. So is there a time period between that which we have to give AFK exam after NDEB approves our registration?
I do not know of any time frame. I did not read it. I'm not aware of anything. If you if you want me to, I can inquire about it and get back to you in the next session that you have. Sorry.
How many years would it take for me to finish the equivalency exam? Exam, I have heard it will take a minimum of 5 years.
Very subjective. I've seen people do it in 2 years. I've seen people do it in 5 years. Average 2 to 3 years is what I, courtesy of Dr. Abbas' side, I put it up there. So 2 to 3 years is ideal. So I've seen people take it once, twice, and they have all made it through.
Okay. And can we start all over from first DDS degree if we do not pass AFK?
That's the only other path that is available for you after that. You have to take the DAT.
And how can we get the details of the specialty exam after periodontics and MDS?
ndeb.ca, it's out there. So you're not, it covers for all the specialty. The problem is, though they say they take it, the best way to do is just call up the university and ask them, are you taking any foreign trained specialty? Just call up the program department and maybe they can answer. As I told you, I know they do take ortho, I know they do take endo, but perio, I've not heard, prostho, I've not heard. I was rejected. Oral medicine, I think they were taking, but it's very limited, very difficult.
Yes, I have another question. When is the AFK exam and the skill exam? Is the skill exam happening every year?
There's some issues. They have stopped it. That's government question to answer. I cannot answer. I'm not in the field or I'm not part of that team. It all depends on the government to take. And I see somebody has asked, can you explain the DAT exam? I can find more about that if you want. In the next session, I can give you. I do know that there's a lot of things. There's something like a prostitutability they will ask you. You have to do some carving and of course your other general questions, science questions that you have to do for that. But I can get you more details in the next session if you have one.
So I have another question. Yeah, it's an interesting one. So some clinics have been accepting international dentists as assistants, but are there any licenses that has to be obtained like IPACS, WIMS, and also do we need to have any proficiency in software like AbleDent or like Dentrix? Because various clinics use like various softwares. And what software do the dentists prefer to have in the resume?
Very good question, very smart question, but a very subjective question. Do you need a WIMS license? IPAC, WIMS, you can take it from the Health Canada site and you can take it. That's if you have it, it's good. Most of us dentists in the dental offices would like our staffs to have it. But it's better if you have it. But we do train them. And regarding the software, again, if you are joined a dental office and if that dental office uses ClearDent, Tracker, Aragon, it all depends on what the dental office that you're joined has. You cannot pre-study it. You have to have a license to enter into it and study it. Or somebody has to teach you. The best thing to do is join somewhere and learn. That's the best thing to do.
Okay. So another question is dental hygienist profession a long-term sustainable one?
Yes, definitely. Definitely. It's a good profession to have.
What are the procedures that can be done after DDS?
You're licensed to kill. I'm joking when I say that. Well, that's what people who told me when I joined DDS told me. What I mean by that is you can do anything, provided you do follow the standard of care. You can do anything. Like I do ortho, but I have my limitations. I tell the patients that I'm not an orthodontist, but I'm comfortable doing ortho. I do a lot of ortho cases. But I've educated myself. I've gone for courses, and I do take courses actively. I'm a prosthodontist. I do a lot of implants, but again, I educate myself. I teach, and I also learn. I go for courses still. I'm so I'm perio surgeries. I do teach. I do learn. I go for courses. I've taken courses. So you have to educate yourself, and you have to follow the standard of care. You just cannot wish-wash things. You have to do everything to the standard of care. You can do anything. There's no restriction. But standard of care is very important. You follow the standard of care for all procedures. You have to know what you're doing. If something goes wrong, somebody asks you a question, why did you do it? Are you qualified to do it? You have to be. You have to defend yourself. Royal College has given specifications of what to do, who can do what. Say, for example, sleep apnea appliance. You have to know, or you have to have so many numbers of orofacial pain or TMD management courses to do a sleep apnea appliance. Because what happens if a problem happens? So, you have to have enough hours. You have to defend yourself academically.
And so the next question is, is HARP certification mandatory for dental assistant? HARP certification.
If you have it, you are more in demand. HARP certification allows you to take exam. Allows you to take the X-rays. There is a college in Welland, St. Catherine. I forgot the name of it. It's a college in Welland. They do teach weekend HARP certification classes, or you can just write to the HARP agency and tell them, I'm a dentist. This is my transcripts that I've taken. I've taken the course. I do know if you can accept it. So I do know. I've heard people were accepted. And I do know that some people were rejected, but I like people to go study the course. It's a 6 months program, easy, not very expensive. You can study it and then you're licensed. So to take your HARP certified, not licensed, you're HARP certified. So that's if you have that, you are a better candidate to get a job. You get more pay. Yeah.
So in fact, our chat box is overwhelming with a lot of questions. So, but we do have a time limit. So I'm going to note down all the questions.
Please.
Yes, and we can arrange for a next session or something to address every queries. Yeah. And so we have here Lenny and Matthew. She's an aspiring candidate. So we would be more than happy to get your feedback.
Hi, I'm Dr. Lenny Ann. I hope you can hear me.
Yes.
Yeah. I would like to take a moment to thank Dr. Nibu for your time and effort. Doctor, most of the dentists who are out there, internationally trained dentists planning to migrate to Canada, would actually be in a dilemma if they have to choose dental hygienist, assistant, or pursue DDS. And a lot of questions like, what is the NDB equivalency process going to be like? How difficult is the exam cost? Thank you so much for talking about all of that and providing us a clear picture about it. Thank you so much, Dr. Nibu. I would also like to thank our MC and moderator. You've done a great job throughout the session. And our team, Ontario Heroes, Mr. Praveen especially. Thank you for organizing a webinar like this. It has been very informative and beneficial as well. Thank you again, Mr. Praveen. We look forward to having more sessions like this. Thank you.
Thank you, Lenny. Lenny is my sister's daughter.
Over to you, Donna.
Okay. Thank you, Dr. Nibu, for your inspiring and motivational words. I'm hoping that...
I hope it was useful.
Yeah, it was. And I'm hoping the Ontario will be having a lot more licensed dentists in the upcoming years.
Definitely.
Okay, then it's a time for word of thanks. I would like to call Dr. Sandeep, International Relation Director of Ontario Heroes. Dr. Sandeep?
Yeah, hello all. A warm good morning to all. Now, this was another interesting session from Ontario Heroes, and I deeply extend my gratitude to Dr. Nibu first for giving us such an enlightened view of what is happening with the dental field here in Canada. So with that being said, I know that I personally myself know that there are a lot of international candidates who aspire to become a dentist here and practice dental medicine here in Canada. So now the points that you have discussed, we have taken those up, and there will be a follow-up session for the same, because as Patricia mentioned, there are a lot of questions coming up in response to our session today. So we are planning to have a next session on the same with all these questions getting involved in it. And we look forward to host that pretty much really soon. Let me thank by starting with you, Dr. Nibu. That was so nice of you to, give us your time on this pleasant day today on a Sunday, that too on a Sunday. We know how busy you are, and you gave us your time, you gave us the knowledge, you gave inspiration to many people out there. So thank you. Thanks a lot.
That's a pleasure.
And going to Patricia and Donna for moderating and managing this session. Wonderful work by you guys, and we expect more for the next sessions. And I wanted to add one more thing here to all the candidates who attended this session. Like Dr. Nibu mentioned, a group study or a group platform for making you guys take this step to the next level and making that process easy. Ontario Heroes, we have a group that has been developed in our webpage. So you can go on to www.ontarioheroes.ca and register yourself so that, you can find not just related to dental. We have a lot of career clinics happening there. We have policing in Ontario, we have licensing in pharmacy, and now we have the dental licensing. So there are a lot more to explore inside our webpage. So I request all of you to take a look into that so that it will be beneficial for you all. And last but not the least, the man behind all of this, Mr. Praveen, he's there, he's watching all of this. So I thank him for, creating such a space, creating the Ontario Heroes as a platform for all and making it beneficial to the entire community here and abroad. So once again, thank you one and all. That's it. Over to you, Donna.
Thank you, Dr. Sandeep.
Thank you, sir. Thank you so much.
Thank you so much.
Thank you very much. Thanks, everybody. And
have a good day.
You too. Have a wonderful evening and have a good day for everybody.